My name is Blight, and I'm with Caregiving Kinetics. I'm the founder of Caregiving Kinetics and also an adjunct professor of healthcare management at Shenandoah University. And I'm doing this video at the International Transformative Learning Conference in New York City. I'd like to tell you a little bit about how my life was transformed by my experience with caregiving and a few of the things that I've learned as a result of caregiving. If I go back to my early 20s, I was working in human resources and equal employment opportunity and envisioned myself in a corporate setting, working in human resources and helping managers and employees work effectively together. I switched into the healthcare world and began working at the Healthcare Financing Administration, and now known as the Centers for Medicare and Medicaid Services. And I was in a new position at CMS as a social science research analyst at just before my 30th birthday. My life was kind of on automatic pilot. I was very busy with new responsibilities at work. We had 3 children at home, and my wife was pregnant with number 4. And the days just flew by. Everything came to a screeching halt in February of that year when my mother-in-law was diagnosed with a brain tumor. She was given 6 to 9 months to live, and we were unprepared for this. She needed to have immediate brain surgery, and she did that at a world-renowned brain surgeon at Johns Hopkins University. And we really didn't know how to deal with this, but we knew that Mom needed help, and so we brought her into our home. She was supposed to stay in our home for about 2 weeks as she recovered from the brain surgery and then move back to her place. I'll never forget what she looked like after the brain surgery. They had shaved her head, and she had staples going up all the way around her skull. What was supposed to be 2 weeks ended up being almost 2 years that she lived in our home. She went through radiation and chemotherapy as she lived with us. My wife had our 4th child as her mother lived in our home, and things were very, very busy and very stressful. I had no idea until this family responsibility of caregiving came what was involved in taking care of a loved one with a chronic illness. Even though I was writing healthcare policy, national healthcare policy at the Centers for Medicare and Medicaid Services, my life was transformed by this personal family experience. My mother-in-law lived for 5.5 years after that original surgery, thanks to the treatments that she had. But her cognitive mental state was never the same. She was in a constant state of cognitive decline, and slowly she was turning into a vegetable over the years. This was the result of the brain surgery that she had had and the lingering effects of it, which was eating her brain cells. Her speech was impaired. She had trouble remembering things, being able to articulate herself, and she was very dependent on us as her family to help her with just regular activities of daily living. Near the end of her life, we were referred to a non-medical home care company who came in and helped my mother-in-law with her activities of daily living. They were a godsend for us. They helped us to deal with all of the physical challenges that my mother-in-law had, and we could focus on the emotional and relational aspects of her dying. About a year after she passed away, my wife invited me to consider leaving CMS, and I started to think about owning my own home health care company. Through a lengthy process, I became the owner of a home care company, and over a 10-year period was able to see that grow and grow and grow to the point that we had almost 400 employees, paid caregivers who were now helping others with the same types of problems that we had with my mother-in-law. Even though I was motivated largely by a desire to help families and individuals in situations like my mother-in-law's, As I owned the home healthcare company, I also grew to appreciate and desire to help my employees. I saw people with outstanding skills and a great sense of empathy and duty toward the elderly and disabled populations, and they sacrificed themselves to care for others. As my company grew, I was fortunate enough to be able to help a lot of individuals, and I went back to school and got a doctorate degree at George Washington University in human and organizational learning. And for my dissertation research, I studied paid caregivers and learned a lot there in terms of research and academic theory that underlies the caregiving experience. When the opportunity came in 2017 to sell my home care company, I was not prepared for that. That wasn't in my plan. But upon reflection, I realized, yes, this was something that I should do. I was able to successfully sell the business and transition my life to something else. That something else led me to create Caregiving Kinetics, a consulting firm that blends business experience and family caregiving experience, policy experience, and also academic research experience in a way that can help others with their caregiving challenges. Today I feel like caregiving called me to do this type of work, and I'm very grateful to be able to help people in all walks of life who are struggling as caregivers, who are working with caregivers, whether paid or unpaid, who need to figure out how to support those who are the backbone of the long-term care system in our nation and in our world. Caregiving is an enormous issue in our society, and I'm very excited to be a part of that experience.